Take it out, Bill.
Let's get a quick level.
Audio level testing 1, 2, 3. Less echoey here. Testing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'll just start with something short and sharp, and then I'll hand over to you. Let me know when you're good to go, Deco. Good morning, all. Well, today we are here for our 32nd Queensland Health Crisis Town Hall, and we said when we begun this journey 2 years ago we would take it to all parts of the state. And here we are today, listening to a group of brave Queenslanders who are coming forward and telling their stories. And there is no doubt that this beautiful part of the world needs improved services and conditions for those working in the hospital and those who rely on the services. To know that the maternity service here has now been closed for almost 18 months shows the perils of a government that has not planned and delivered services for Queenslanders no matter where they live. Now, the word bypass continues to be used. We are approaching 18 months without this service for a part of the state that provides a maternity service to a massive part of Queensland, and an important part. And today we've already heard stories of mums playing Russian roulette and having babies at home because of a lack of service here where they live. And it is not good enough. And it is a tale that we are hearing across the state of Queensland mums who are unable to have a baby where, when and how they choose. And we are better than that as a state. And so today we are calling on the government to commit when this service will return, because we are dealing with a large part of Queensland that needs and deserves this service. And this is a playbook we have seen before. This service was closed and it was restored in 2015. And to know that we are now approaching 18 months and there is no end in sight is deeply disappointing. And before I hand back for questions, I just want to make some comments regarding the litany of excuses we're hearing today for why the health crisis continues to worsen. The figures paint a picture of less people turning up to our emergency departments than 2 years ago, and despite that, ambulance ramping has never been worse. And that is because of a failure to plan and deliver services for Queenslanders. So we've seen the PR offensive, we've seen ministers and the Premier running around trying to use selective figures to paint a different tale, but in the end, Queensland's ambulance ramping is the worst in the country, and the number of people turning up at the emergency departments are fewer today than 2 years ago. That says only one thing, and that is a government that has not planned and resourced our health system properly. And the solutions are on the table, and they have come from meetings like this. Better resources, better triaging, sharing data in real time, and putting doctors and nurses back in charge in the communities in which they work. Over to you.
How concerned are you about Cooktown going on 18 months? We're also now worried about Cairns Private Hospital reviewing their maternity services.
Gladstone, Cairns, Chinchilla, Cooktown, Weipa. There is a history of services closing and not coming back online. And I'm not comfortable with a Queensland where young mums can't have a baby where, when and how they choose. And I was born in a small regional hospital, and I want to know that the next generation of mums can do what my mother did. And to continue to use the word bypass when the government hasn't set any timelines on when it will return, well, that's being sneaky and it's being tricky. Set a date, resource it properly, and deliver the kind of world-class health facilities that Queensland women deserve no matter where they live.
In terms of the Health Minister announcing a new cost of living allowance for final year student nurses while in Mackay over the weekend, do you think that's going to be enough to attract staff to the sector?
We will support anything that can help heal the Queensland health crisis. So let us find the ways to attract the best across the globe. Let us also value and respect the ones that we have and keep them in the system. Because at the moment, nurses and doctors are leaving in droves, and we've got to value them and respect them, and we need to attract the next generation as well.
Do you think it's about time the Health Minister came up here and visited Cooktown?
What is the Health Minister's plan to ensure that services in Cairns can continue to give women the choice between the private and public sector, and that Cooktown can come back online and allow mums to deliver babies where they live. Anything short of that is a lot of PR offensive, but not delivering. And I'm just not comfortable in such a large part of Queensland not having services for young women to be able to have a baby. And I'm certainly not comfortable with stories of women having babies at home because they're just not prepared to pack up and leave and head hours away from where they live. And it does not make sense that in a modern Queensland we can't properly resource a health system and put doctors and nurses back in charge to do that.
Just on crime in the Gold Coast, 8 children have been charged over a pretty terrifying carjacking. What would be your thoughts on that?
How did we reach this point in Queensland where everyday residents have become fair game for a generation of untouchables? People reversing their car in their garage and being ambushed. How did we reach this point? At what point will the government listen to the solutions that start with consequences for action, unshackling the judiciary and removing detention as a last resort, and getting serious about early intervention? Because what is happening at the moment is broken, and Queenslanders in every part of the state are waking up to news of not feeling safe in their homes and their businesses. And when it reaches the point that somebody who is reversing out of their driveway or just going to work, it just gets caught up as collateral damage because of a generation of untouchables, you know the system is broken. It was watered down 8 years ago, and nothing short of wholesale change of the Youth Justice Act and getting serious about early intervention will cut it.
In Townsville, 16 cars were stolen. One swerved at a police officer. They had to jump behind a tree to survive. What needs to be done to keep our officers safer?
There was a time when young offenders ran from the law, and now they run at the law. That's how much they thumb their nose at a broken system. That's what a joke they think the Youth Justice Act is. They know that their rights are greater than the rights of the victim. It is just broken.
Outside of health, what do you think are the big issues for Portland?
Housing is massive, and we've heard that loud and clear, and I'm going to council after this to listen to the council. But there's no doubt that the health system here is underperforming, but the housing crisis is directly linked to that, and the ability to attract people to come and live in a beautiful part of the world is very difficult if they can't afford to be able to have a home. And of course, law and order is a big issue across the state. So in the end, it boils down to service delivery. Queenslanders want to know that they can live in a place where the economy can support small and family business to do their thing and employ people. They want to know that the government can conduct itself with integrity and be open and honest with figures and transparency, the way they conduct themselves. But they also need to rely on world-class services. And by any metric, service delivery is breaking down in this state, and the government is rotting before the eyes of Queenslanders, and that does no one any good. And the more remote you are, the more you feel it. The further you are away from the capital, the more that these things are pronounced and impact your daily life, and that's where we've reached.
When can we expect an LNP candidate confirmed for Cook?
I want to make the commitment to the people here today that we are serious about this region, and we will pre-select somebody who is from here, who understands the place, and more importantly will be able to go into bat for you for those issues that we've spoken about. It'll be done well ahead of the state election, which is still nearly 18 months away, but I intend to make sure that people know who the candidate is, and they will know well ahead of time, and they will be able to get an opportunity to have someone who will go in and have a red hot crack for them.
So, and going back to health again, trying to take the hospital and health service for over a year now, I've had plans on the table, basically shovel ready for a new hospital for Cooktown, which is sort of going to service the lower Cape. Will the LNP commit to funding that?
There was a lot of noise made about a business case, and that business case has been sitting on the Premier's desk for a long time. So the opportunity to put back into the region is this budget. So we're going to watch with eagle eyes, and there is no doubt that governments can't continue to talk about planning for plans and having business cases for to delay things. If you're doing planning, if you're doing a business case, you've got to show the colour of the money. And this region deserves world-class facilities, not just the bricks and mortar though, but also the services. So what is the plan for the government to deliver world-class facilities here? What is the plan to attract and retain medical professionals who can come here and provide services like maternity to a generation of people who want to be able to live in a beautiful part of the state like this?
So would the LNP commit
Let-
50 million
let-
next year if you're elected?
Let's have a look. Let's have a look at what the government does first. There's still 18 months before the next election, and I sincerely hope that it doesn't have to get to an election for a commitment to be made for something that this community deserves. Now, if it gets to that, well then you'll have a chance to know long before the election day where we sit. But in the meantime, I'm going to put the government on notice that it's been many years since this so-called business case was touted. This is the budget to show the people of Cooktown that we're serious about their welfare. All right, let's go. See you guys. Thanks very much.